Ladies and gentlemen, please sit. Of Islamic economics, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Allahumma salli ala Muhammad wa ala ali Muhammad. Allahumma aftah li futuhal arifina bihikmatika wansur alayya rahmataka wa dzakirni ma nasidu ya dzal jalali wal ikram. Rabbi israh li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Ya Allah, the giver of mercy, we ask you, Ya Allah, please give us our blessing in carrying out activities, expedite, bless and keep us from difficulties and carrying out all the series of events from start to finish. Ya Allah, help us so that the activity will be meaningful, the purpose of this activity, and make it easier for us to understand all the material conveyed by all sorts. Ya Allah, the giver of guidance, for all your goodness, Ya Allah, with us, and like our way in achieving the straight path that and do not let us go astray. After you have instructed us, the truth is yours, Ya Allah. We are only trying to reach it, Ya Allah. Ya Allah, forgive all our sins, forgive all the sins of our teachers and also our parents. Forgive our ladies and the heirs of our nation. Rabbana taqabbal minna Rabbana taqabbal minna Rabbana atina fid dunya hasanah wa fil akhirati hasanatan wa qina adzabannar walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
His Excellency, Rector, University Muhammadiyah of Kudus, Dr. Candidate Risnawati, Master of Epidemiology, the Honorable All Speaker, Professor Kuo Su Chen, Adjunct Professor, Department of Nurse Midwifery at Women Health College of Nursing, National Taipei University of Nursing and Health Science, Taiwan. Ms. Tung Yuching, Registered Nurse, Assistant Head Nurse, Labor and Delivery Ward, Canggung Memorial Hospital. Mrs. Indah Risnawati, Master of Midwifery, the head of Bachelor Degree of Midwifery Study Program. Dr. Candidate Umi Faridah, Master of Nursing Science, the head of Bachelor Degree Nursing Science Program. The Honorable Vice Rector for Academic Affairs, Mrs. Nur Hidayah, Master of Health. The Honorable Vice Rector for Administration and Finance, Mr. Rizka Himawan, Master of Psychology. The Honorable Vice Rector for Student Affairs and Cooperation, Dr. Candidate Ani Rosiana Masito, Master of Nursing, Mental Health Nurse Specialist. The Honorable the Dean of Health Faculty, Mrs. Indah, Master of Nursing, Pediatric Nurse Specialist. The Honorable the Dean of Faculty of Science and Technology, and Faculty of Economic Education and Law, Mr. M. Purnomo, Master of Health Law. The Honorable, the Head of Laboratory Department, Mrs. Dwi Astuti, Master of Health, Superintendent of Taipei Hospital and Taiwan International Healthcare Training Center, and all participants. In the name of Lord, today we are gathering virtually on 4th International Webinar Series on Midwifery in the agenda of 21st Anniversary University Muhammadiyah of Kudus. Opening remark from Vice Rector for Administration and Finance to Mr. Rizka Himawan, Master of Psychology. The floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Innal hamdalillah nahmadu wa nasta'inu wa nastaghfiruh wa na'udzu billahi min shururi anfusina wa min sayyiati a'malina. May yahdihillahu fala mudhillalah wa may yudlil fala hadiyalah. Asyhadu an la ilaha illallah wahdahu la syarikalah wa asyhadu anna Muhammadan abduhu wa rasuluh. Allahumma sholli ala Muhammad wa ala alihi wa sahbihi ajma'in. Amma ba'd. Good morning, ladies and gentlemen. His Excellency Rector University Muhammadiyah Kudus, Dr. Candidate Risnawati, Master of Epidemiology, the Honorable All Speaker, Professor Kuo Su Chen, Adjunct Professor, Department of Nurse, Midwifery and Women Health, College of Nursing, National Taipei University of Nursing and Health Science, Taiwan. Ms. Tung Yuching, Registered Nurse, Assistant Head Nurse, Labor and Delivery Ward, Canggung Memorial Hospital. Mrs. Indah Risnawati, Master of Midwifery, the Head of Bachelor Degree of Midwifery Study Program. Dr. Candidate Umi Faridah, Magister of Nursing Science, the Head of Bachelor Degree Nursing Science Program. The Honorable Vice Rector for Student Affairs and Cooperation, Dr. Candidate Ani Rosiana Masitoh, Master of Nursing, Mental Health Nurse Specialist. The Honorable Vice Rector for Academic Affairs, Mrs. Nur Hidayah, Master of Health. The Honorable the Dean of Health Faculty, Mrs. Indah, Master of Nursing, Pediatric Nurse Specialist. The Honorable the Dean of Faculty of Science and Technology and Faculties of Economics, Education and Law, Mr. M. Purnomo, Master of Health Law. The Honorable the Head of Laboratory Department, Mrs. Dwi Astuti, Master of Health, Superintendent of Taipei Hospital and Taiwan International Healthcare Training Center, and all participants. Dear participants of our webinar conference series. Ladies and gentlemen, firstly, let us praise to be Allah, the Lord of the worlds, and the sequel is for those who keep their duty unto Him. Further, there will be no hostility except against wrongdoers. Secondly, salawat and salam is sent Honorable Prophet Muhammad sallallahu alaihi wasallam, his family, all his disciples, and those who follow them in goodness till the day of judgment. In this very special occasion, I am pleased to welcome you to the 4th International Webinar Series on Midwifery entitled Conducting Midwifery, Care for Nutritional Status of Children During Pandemic Covid-19. This is part of conference series in 21 anniversary, or we call Milad Universitas Muhammadiyah Kudus agenda. Ladies and gentlemen, every woman deserves access to quality midwifery care during pregnancy and childbirth, especially in this pandemic COVID-19 era. Midwife is the best partner of the pregnant woman. Of course, midwives, when well educated and supported by a functional health system, can help effort over two-thirds of all maternal and newborn deaths. The right midwifery care for children. So what nutritional status is beneficial to ensure women and their newborns for their pregnancy and childbirth safely. And later on, the intrusive, respectful, and well-resourced maternity care that can create a lifetime of good health and well-being beyond the childbirth continuum. The quality of a midwife care is of a paramount importance. Midwives who are educated and trained, they are able to lead the way toward improved maternal and newborn health custom locally, nationally, and globally. And today's webinar will talk about this very deep. Ladies and gentlemen, I would say that we all should be grateful and confident with some of the achievement of the Muhammadiyah University of Kudus. Among other things, the change either from Stikes Muhammadiyah Kudus to Muhammadiyah Kudus University, the escape was handed over by the President of the Republik Indonesia, Insinyur Haji Joko Widodo. Universitas Muhammadiyah Kudus, or UMKU, is now having 20 study program divided in 3 faculties. Furthermore, to support the internationalization of the institution, UMKU has established foreign cooperation with 37 universities, both state and private universities in Taiwan, Malaysia, Brunei Darussalam, Korea, Japan, and Philippines. Muhammadiyah Kudus University also has a commitment to empowering graduates by working with 20 hospitals throughout the Pati Residency, Bintaro International Hospital, and Ananda Hospital. One of the UMKU's vision is being global. This international conference is one among many efforts to make this vision come true. I believe that by participating in this international webinar, we are in the right place at the right time, and I wish you all a very successful webinar. Hairul Kalam, thank you for your attention and collaboration. Wassalamualaikum warahmatullahi wabarakatuh.
Now we come to the main agenda of 4th International Webinar Series on Midwifery. In the agenda of 21st Anniversary University Muhammadiyah of Kudus, entitled Conducting Midwifery Care for Nutritional Status of Children During Pandemic Covid-19. This will be guided by Mr. Ahmad Nur Safik, Master of Education, as moderator. The floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Salatu wassalamu ala Rasulillah ajma'in, amma ba'd. First of all, let's say praise to our Lord Allah Subhanahu wa ta'ala for his mercies and blessings. And then our deep gratitude please send upon our Prophet Muhammad sallallahu alaihi wasallam. Amin. Well, ladies and gentlemen, welcome back to the 4th International Webinar Series on Midwifery today. It's an honor for me to be here today My name is Ahmad Nur Shafiq, and I'll be serving as the moderator for this webinar. One more time, I'd like to say this virtual conference is held in the agenda of 21st anniversary of Muhammadiyah University of Kudus. Then before I begin the presentation, I'd like to say thank you one more time to Superintendents of Taiwan International Health Training Center to support this conference very well. Well, ladies and gentlemen, the quality of midwife care is really important during this pandemic, as the welcoming remark for the Vice Rector today. Midwives are educated and trained, and then they are able to lead the way toward improve the maternal and newborn health outcome locally, even nationally and globally. And this is going to be our topic for this webinar today, conducting the midwifery care of child nutritional status during pandemic COVID-19 today. Right now, together with us, we have three expert speakers who will talk about this topic today. And then to save our time, now let's keep in touch with the first speaker, Mrs. Indah Risnawati. I'll let you to come to stage, Ms. Indah. Now give a big applause to Mrs. Indah Risnawati, Magister of Midwifery. Well, ladies and gentlemen, now for the first presentation delivered by Mrs. Indah Risnawati. How are you today, Miss? Right, you can use this one. Okay.
I'm great, fine.
Alhamdulillah, you're fine. So I think it's going to be really wonderful presentation for the first presenter. But hold on, before she delivers the presentation, today she will talk about the antenatal care. And before she delivers her wonderful presentation, let me introduce her for a while. Right, her full name is Indah Risnawati. Then she was born in Jepara, 10th of June 1982. Then about her educational background, she completed for a diploma of midwifery program of Polytechnic Semarang. Then she continued for diploma 4 degree in Mutiwaluyo Semarang. Is that right, Miss? Okay. And then she also continue for the master degree of midwifery in Universitas Pajajaran Bandung. About his occupation right now, she is a lecturer of Universitas Muhammadiyah Kudus in 2007. Oh my God! So about 10 years or more than 10 years you have been working here. And then she also worked as the trust study in 2016. She is also the head of a study program of midwifery program of Universitas Muhammadiyah Kudus since 2018 till now. About her publications, there are so many publications that I can mention one by one, but at least she is famous with the title of a factor related to the event of pulmonary tuberculosis. So she is the new one. And also she published a new book entitled Anemia in a Midwifery or Anemia dalam Kehamilan. Right, to save our time, now let's go directly for the first presentation delivered by Mrs. Indah Risnawati. So now the floor is yours, Miss.
Thank you, Mr. Shafiq, for having me, and thanks for the time. I like to presentation the theme of today, and before that, I want to thanks a lot of moderator give me time, and the Honorable Rector University Muhammadiyah Kudus, Dr. Candidate Rusnato, Master of Epidemiology, the Honorable Vice Rector 1, 2, 3, Mr. Rizka Himawan, Mrs. Ani Rosiana Masito, and Mrs. Nur Hidayah, Miss Nur Hidayah. The Honorable the Dean of Health Faculty, Mrs. Indana, Master of Nursing Pediatric Nurse Specialist, and Mr. Muhammad Purnomo, Master of Health Law, and the Honorable all the speaker Prof. Kuo Su Chen, the Adjunct Professor, Department of Nurse Midwifery and Women Health College of Nursing, National Taipei University of Nursing and Health Science, Taiwan. Ms. Tung Yu Ching, Register Nurse, Assistant Head Nurse, Labor and Delivery Ward, Canggung Memorial Hospital. The doctor candidate, Ms. Umi Faridah, Master of Nursing Science, and lectures and the entire team supporting the holding of this day, and all participants who joined today via virtual Zoom. Thank you for your support and participation in the 4th International Webinar Series, which is the final webinar. Am I right, Mr. Sabit?
Absolutely, yes.
Today, them is about antenatal care during a pandemic. As we know, the number of maternal and infant deaths in Indonesia is still quite high. This is due to many factors. The health of pregnant women can be an indicator that will reduce maternal and infant mortality rates. Antenatal care is a media, one of the media for examining pregnant women to monitor the health of the mother and fetus. Okay, the outline of today is the status of pregnant women in global and in Indonesia, prevalence of pregnant women with COVID-19, what is the purpose of antenatal care, standard of antenatal care, and principles of management of coronavirus disease 2019 in pregnancy, of COVID-19 in pregnancy. Next. This is the update of COVID-19 in Indonesia until today. Yesterday in December 3rd. Based on the COVID-19 task force, the latest data in Indonesia shows an increase with a positive overall number of 500,000 more as of 2 December 2020, with the number of increases per day. Yesterday is record and 8,000 more as of December 3rd. That is a number of every day, because every day there are more and more new cases. This shows there is no sign of decline. Meanwhile, globally there are several countries that have experienced a decline, but in Indonesia, like every day. Next. COVID-19 in pregnancy requires attention because according to this data, the total number of cases in the US is 40,000 more, with a mortality rate of 54 pregnant women. Meanwhile, in Indonesia, pregnant women are one of the vulnerable groups and are at risk of experiencing COVID-19 with a percentage of 7.2%. This should get our attention because pregnancy will increasingly affect the mother and the fetus. This is the attention because fetus in pregnancy woman must protect it. Next. This is pregnancy rates in Indonesia. Some information show data on the increase in unplanned pregnancy rates. Let's look and claims there will more than 400,000 new pregnancy during the pandemic period in Indonesia. This is due to the lack of access of mother to providers contraceptive services. Besides, work from home and stay at home during the pandemic to be one of the factors. And then, what about pregnancy? During the pandemic, pregnant women feel a lot of concern in carrying out antenatal examination. They feel paranoid about in the hospital, visiting healthcare facilities. So there are many adverse events for the mother related to services and also fear of providers in serving, because there are procedures that must be done to prevent transmission. COVID-19, such as lack of protective personal equipment or APD, lack of patient awareness in implementing health protocols, and so on. So that ANC or antenatal care is very important to equip mother and husband in preparing for everything to face pregnancy during pandemic. Next. This is one of the largest study reporting an increase in birth in the Lancet journal. This study is based on data from 20,000 pregnant women who gave birth in 9 hospitals in Nepal. According to study, the birth rate has increased from 14 stillbirth per 1,000 birth to 20 per 1,000 birth during the pandemic and the end of May. This sharp increase occurred during the first 4 weeks of the lockdown, during which people only went out to buy food and emergency care. So the pregnant woman is from home, just out to buy some food and buy just for medicine. Next. So what is the purpose of antenatal care? Antenatal care is very important for pregnant women. It's not just for mother, but this is important to look the growth for the fetus and the status of healthy of pregnant women. And the purpose of antenatal care to diagnose and treat problem, to know what the problems of maternal health, and to prevent problem, so they can give preventive and then to promote well-being. So antenatal care can give a good status for mother and for fetus to know what they know about her body and what they know about her fetus, so they can preventive when she have some problem with the pregnant. Okay, next. The guidance antenatal care service by midwife during a pandemic. If the pregnant woman has no complaints, please apply the content of the KIA books. And every mother, every pregnant woman in Indonesia have the book is named KIA, buku KIA, and then every mother have reading every day, have a book to know what is the content of the book. Please apply the content of the KIA book at home immediately to the healthcare facility if there is a complaint or danger sign. Yeah, and then online classes for pregnant women, prenatal yoga class and pregnant class. Now is online class is most popular. Pregnancy consultation, KIA is communication, information, and education counseling, can be done online by WhatsApp group, by Instagram, or everything online class. Conduct a comprehensive assessment in accordance with the standard with COVID-19 awareness. Can coordinate with community about the status of the mother. Pregnant women and husband wear mask and apply COVID-19 prevention protocol. Not just a mother, but the husband too wear mask and mass awareness about that. Mother makes appointment by phone or WhatsApp. Antenatal care in first trimester collaboration with doctor for health check-up. And then antenatal care is carried out according to standard 10T, 10T, 10C, timbang, and so on, with PPE level 1, APD level 1, screening risk factor refer to the standard. Next. But the problems in the pandemic era, this is the challenge for us and as a midwife, because the problem in the community, too many asymptomatic activities as usual. Risk of transmitting to pregnant women. There is no COVID screening for pregnant women. Example, rapid test. A lot of information related to COVID-19 by WhatsApp or internet is not necessarily all true, hoax. So there is still a wide variety of people understanding of COVID-19. Decreased awareness of implementing COVID-19 protocol, anxiety level of pregnant women are very high, and community compliance is still low. This is the problem. And this is the challenge for midwife to looking for solution. Next, and then midwife challenge, difficulty in application of PPE or APD and infection prevention materials, difficult to obtain and expensive. Yes, APD is very expensive, meter traffic. Yeah. And then low awareness of patient is applying 3M, memakai masker, mencuci tangan, and then menjaga jarak. Midwives concerned when getting pregnant women affected by COVID-19 and dishonest. That is the problem, a big problem. When the patient is dishonest, they not tell the truth. Then when she have positive COVID-19. Limitation of screening procedures in self-service place, rapid or PCR. Pregnant women are afraid to come to clinic or hospital because they feel scary about hospital, and then they're very insecure about that. Okay. And pregnant woman and breastfeeding is very high risk about the COVID-19. So pregnant woman has have awareness about how to increase the body immunity. And to increase body immunity and in a pregnant woman, so she have consumption of nutrition, food, and vitamins and mineral, plays in immunomodulators, and then regular exercise by yoga or by just walk in the morning. And then enough rest, maybe sleep 7 hours a day, and then manage stress. Next. Pregnant people are at an increased risk for severe illness from COVID-19. Compared to non-pregnant people. Additionally, pregnant people with COVID-19 might be at increased risk for other adverse outcomes, such as preterm birth, premature. So this is the impact of COVID-19 in a pregnant woman. There is no way to ensure you have zero risk of infection, so it is important to understand the risk and know how to be as safe as possible. In general, the more people you interact with, the more closely you interact with them, and the longer than interaction, the higher your risk of getting and spreading COVID-19. Next, and then take steps to protect yourself from COVID-19 in a pregnant woman. Here are preventive steps you and people you live with can take. Limit interaction with people that might have been exposed to or infected with COVID-19, including people within your household as much as possible. When going out or interacting with others outside your immediate household, wear masks, especially when other social distancing measures are difficult to maintain. Not that wearing a mask is not a substitute for other everyday prevention action like washing hands frequently and avoiding close contact with other people. And then avoid others who are not wearing masks or ask others around you to wear a mask if possible. So now maybe around us in our house is decreased awareness about wear mask and application of 3M. Stay at least 6 feet away from others outside your household. Wash your hand with soap and water for at least 20 seconds. Avoid activities where taking protective measures may be difficult and where social distancing can be maintained. Continue to seek healthcare. Don't skip your healthcare appointment during and after pregnancy because visit your health. This is very important. Visit your healthcare provider for all recommended appointment. If you need help finding one, contact your nearest hospital, clinic, community health center, external icon, or health department. Talk to your healthcare provider about how to stay healthy and take care of yourself and your baby. Any question you have about the best place to deliver your baby, delivering your baby is always safe under the care of trained healthcare professional. One of them is midwife. If you're concerned about going to your appointment because of COVID-19, ask your healthcare provider what step they're taking to separate healthy patients from those who may be sick. Some healthcare providers may choose to cancel or postpone some visits. Others may switch certain appointments to telemedicine visit, as now is very trend, which are appointment of the phone or video. This decision may be based on the situation in your community as well as your individual health risk. So we just look around us, what the situation and condition, so we can decision how we go to clinic or seek healthcare. Call your healthcare provider if you have any health concern. This concern may include you think you have COVID-19, call within 24 hours and not longer than that. You think you are experiencing depression during or after pregnancy. You have any question related to your health. If necessary, face-to-face contact. Current WHO guidance recommend a minimum of 8 antenatal contact for low-risk women. 5 visit or fever is associated with increased risk of perinatal mortality. A minimum of 6 face-to-face physical antenatal consultation is therefore advised. This is if you have a problem. Okay. And standard of examination, one time in first trimester, for maternal health screening, doctor examination is better, and 6-time examination by the midwife, and the third trimester for detection of pregnancy complication, referral preparation if necessary. Next. Next slide. Okay. Remote care support can by telephone and video consultation to specialist care, mental health if necessary, safeguarding, birth planning, shielded woman, quarantine woman, and parenting advice. Such as care schedule, one-stop or virtual booking, appointment scans and tests in a single visit, use remote appointment to screen for who needs a face-to-face encounter, ambulatory option, and special consideration for COVID-19 vulnerable women like obesitas, diabetes, and asthma, and the pregnant woman who get a high risk. And then care of suspect or proven COVID-19 in pregnancy, care away from hospital where possible, infection prevention or control consideration, maintenance or catch up of antenatal care afterwards. If hospitalized, growth scan after 14 days, thromboprophylaxis for admission plus 10 days. And principles of management of coronavirus disease of COVID-19 in pregnancy include early isolation, aggressive infection control procedures, oxygen therapy, avoidance of fluid overload, consideration of empiric antibiotics, laboratory testing for the virus and co-infection, fetal and uterine contraction monitoring, early mechanical ventilation for progressive respiratory failure, and individualist delivery planning, and a team-based approach with multi-specialty consultation. And then, last but not least, point to remember, pregnant women must continue to do antenatal care by implementing the health protocol. Antenatal care can be done face-to-face or online. The effort made by midwife and patients are to maintain immunity and prevent transmission of COVID-19. This is must underline, because we can meet face-to-face, but have to be careful. Educate pregnant women about the dangers of COVID-19, and always pray. That most important. Everything, always pray. Okay, thanks.
Right, so that's the wonderful presentation from Mrs. Indah Risnawati. So, yes, you talk about the antenatal care. If I can speak in a very short, that now every single pregnant woman must be careful, right, to do like a health protocol during this pandemic. So, she must, be relevant about the staying away to use the health protocol during pandemic. Then, okay, to comprehend our understanding about the presentations or wonderful presentation from Mrs. Indah Risnawati, now I invite directly for a discussion session. Is that okay, Mom? Okay, so I will open the question and answer session. And I will invite all webinar participants to join the question and answer session, and also all audience here, if you have any questions, just participate for this question and answer session. Is there any? The audience here? Yes? Okay. The lady in the middle, please. Right, would you please stand up and then introduce yourself before you give your questions?
Okay, thank you for giving me time to asking the question. Mrs. Indah, I would like to ask to you, maybe you can tell us about suggestion or your explanation how to maintain the nutritional status of pregnant women and tips for keeping their mental health who's diagnosed COVID-19. Thank you.
Right. Okay, that's the questions. So if I can repeat the question from Ibu Dia. All right. So the question is, how can we maintain a pregnant mother with the COVID-19? So what is the suggestions? What is your suggestions? So would you give your explanation, Miss Indah Risnawati? Right. You will go directly to explain this question.
Okay, thank you, Ms. Dia. The question is how to maintain of nutrition. The
Health
first
nutritional status, okay.
nutritional status of pregnant woman
Right, and child.
and child.
Right.
Okay. Nutrition for pregnant women is so very important to help a growth baby or fetus and in the uterine. So the pregnant woman have to consume a lot of food combining or full of nutrition, such as carbohydrate, protein, and then high protein, and then a lot of vegetables, a lot of some minerals. So the portion is much more than before she pregnant. Okay, and then how to maintain a second question?
Right. How to maintain the mental health for the pregnant mother who is diagnosed by COVID-19, if I'm not mistaken, right? Okay. So how can we maintain the pregnant woman who suffer from COVID-19 virus?
Okay. The first time pregnant woman with COVID-19 is maybe denied or she's very sad about that. So we have to, as a midwife, to take care about mental or psychology or psyches. We have to give a support. Without application of 3M, still give application of standard procedure of COVID-19. But the husband have to give support to pregnant women, so they not feel alone. They not feel alone. So the pregnant woman still have strong, and she have a lot of support of a family, around a family. And the family have give support to her, because the support is very important for her. Okay, and maybe telephone and video consultation can help her to make her stronger when she have COVID-19. I think. Thank you.
Right,
Mr.
so
Taufik.
that's the amazing answer and explanation from Mrs. Indah Risnawati to the questionnaire. Ibu Dia, so is that answering your questions? Okay, thank you. So now we are moving to the second question. Ms. Indah, is that okay? Okay. Now we have a webinar participants questions. Yes? Okay. For the second question coming from the participant from webinars. The questions is, okay. The question from Fariza. The question is, one of my friends just got married a while ago. She has plans for the first pregnancy, but she is so worried about the current pandemic trend, more increase in our country. Can you give advice so that my friend can be safe and feeling comfortable her pregnancy plan? Thank you. So maybe she needs suggestions. She is getting married.
Yes.
And then
Congratulations.
Congratulations, you get planned to get a child, but knows what happened right now.
Yes.
We are in the middle of pandemic. So would you give your suggestions, Mom?
Okay. Congratulations to Miss Faridah's friend. Okay. And can you give advice? Okay. Yes, my advice. One, they have. You have to planning your pregnant, because in the pandemic like this, the fear of examination to hospital maybe need support from midwife, because too many asymptomatic activities as usual. We don't know around us who is positive COVID-19. So pregnant woman have to, before she pregnant, she have to know, check all to examination the body, to know the health status of her, and then maybe she need to screening before her pregnant, and every day maybe she need to read a lot of information related to COVID-19, but the information is true, not the information is hoax, because this is necessarily for women to know what is the condition of COVID-19 now. And then give a lot of nutrition of her, and then support family if she wants to pregnant. If she wants to really want to pregnant now, it doesn't matter, but she have to always positive thinking, and then always to stay health protocol. I think like that.
Right, that was an amazing, wonderful explanation from Mrs. Indah Risnawati. Hopefully to those who ask the questions can be understand, and it's very clear. Okay, is there any more questions? Yes or no? I invite all participants webinar to join for the question and answer session. The audience here, if you have any, no more questions? Hello? Okay, right. So, yeah, I think it could be really, really wonderful presentation from Mrs. Indah Risnawati. Yeah, I think there are no more questions. It seems that I will close this session for the first presentation. But before Miss Indah Risnawati Miss Indah Risnawati end for this session, I will give her to give a closing statement, ma'am, please.
Okay, for me.
All right.
Antenatal care is very important to know the health, the status of health for pregnant women, and I think it's not about examination. As a midwife, we have to know about how the status of psychology. When pregnant women feel happy, I think that can be a pregnant woman happy is very important to make her and a fetus to grow better. And then midwife have support to psychology because antenatal care is to know health status. And then in the pandemic era like this, must be prevent everywhere. And then always taking care of her and the family to free from COVID-19. Okay, thank you.
That's a really good sentence. One more time, give a big applause to Mrs. Indah Risnawati for the wonderful presentation. And finally, I must close this session because we are moving to the next session. Right, one more time, I say thank you very much, Ibu Indah Risnawati, for
thank you, and
joining
sorry,
this
my
conference.
English is not well.
Oh, really, really good. So it can be understood really, really clear. And for Ms. Indah Risnawati, I would say thank you very much for your participation for this webinar. And I think that's the end for the first session, and I will turn it back to Master of Ceremony. Please, yours.
Okay, thank you, Mr. Shafiq. Ladies and gentlemen, the next agenda is video from Taiwan International Healthcare Training Center. Please enjoy.
Over the past 50 years, Taiwan experienced economic boom that transitioned Taiwan's role from a recipient country to donor country. Now Taiwan is one of the advanced countries in the world in medical and healthcare technologies. In 1995, we successfully implemented the mandatory National Health Insurance Program with 99.8% coverage rate, with an expenditure of only 6.6% of GDP. This has brought about significant improvements in the health of the 23 million citizens in Taiwan. In 2016, the United Nations announced the Sustainable Development Goals for 2030. As a global citizen, Taiwan must play an integral part in the pursuit of sustainable development in the world. On international healthcare issues, Taiwan is both willing and able to work together with the international community in formulating future development strategies. 15 years ago, Taiwan initiated plans to proactively share its advanced medical technology and resources. Thus, the Taiwan International Healthcare Training Center was established. Under the Ministry of Health and Welfare and executed by Taipei Hospital, the center must carry out international health cooperation and aid. The Taiwan International Healthcare Training Center is responsible for the training of international healthcare personnel and hosts international academic conferences, as well as provide international clinical services and assist in international emergency rescue missions. By the unwavered efforts of Ministry of Health and Welfare and Taipei Hospital, the center received the Bronze Award of 2012 National Biotechnology and Medical Care Quality Award. Moreover, in 2016, the center won the first International Medical Model Prize Group Award. In the era of globalization and increasing awareness of humanitarianism, international healthcare collaboration is the key to eradicate health inequality around the world. Governmental and non-governmental institutions around the world recognize that access to healthcare is one of the most basic human rights. Healthcare personnel around the world now share common responsibilities as contributors, and TIHTC in Taiwan is the platform for like-minded, compassionate professionals like yourself. Not to mention, the center provides accommodation and offers comprehensive care to host all of our distinguished guests and trainees. On behalf of the Taiwan International Healthcare Training Center, we sincerely welcome prospective participants to join our world-class educational programs. As we nurture partnerships between health workers around the globe, our center shares the tools to better build health systems worldwide and to empower professionals like you. Since 2002, the Taiwan International Healthcare Training Center has provided clinical and healthcare management courses to nearly 1,500 professionals from 60 countries. Continuing education and hands-on training help the center's participants develop their skills and stay abreast of the latest medical developments so that they are prepared for new healthcare challenges in their homelands. Furthermore, the center has partnered with 30 hospitals across Taiwan to conduct world-class training led by outstanding and dedicated professionals from top healthcare institutions. Taiwan is also known as Formosa, meaning beautiful island. The diversity of Taiwan's culture and heritage is the integration of different ethnic groups and illustrate the harmony and prosperity possible among various religions, architecture, languages, lifestyles, and cuisines. The world-renowned Taipei 101 Tower is also known as the Taipei Financial Center. It is the landmark skyscraper located in Taipei. There are more than 300 night markets in Taiwan, where you can experience the various tasty traditional Taiwanese snacks. Just like the proverb, teach a man to fish and you will feed him for life. The Taiwan International Healthcare Training Center seeks to develop the foundations of self-sufficient health services as well as improve the overall quality of life for our international partners.
Good day, I am Dr. Sun-Pin Chen, the Superintendent of Taipei Hospital. On behalf of the Taiwan International Healthcare Training Center, TIHTC, Taipei Hospital, I would like to extend my warmest welcome to all of you. During the past 18 years, over 1,600 medical professionals from 68 countries have received training through TIHTC. Now, the center is training over 100 international medical health and administration personnel per year, and is regarded as the co-international cooperation unit of Taipei Hospital. This year, due to the COVID-19, TIHTC have moved the project training programs online. Now, medical professionals around the world can continue to further their medical training through the online platform without being affected by the pandemic. Taipei Hospital and TIHTC will continue to provide tailored project training courses and work hand in hand with medical institutions to develop international healthcare talents. These courses and exchanges will play a contributing role in improving the medical standards and public health promotion in all corners of the world. As an international healthcare training institutions, we are proud to announce that 2020 online project training programs are now officially open.
TIHTC welcomes you on board to improve health for all. Yay!
In this joyous occasion, the Taiwan International Healthcare Training Center would like to thank you for all your support. We look forward to seeing you. Join Taiwan and be a contributor.
Now we move to session 2, the presentation from Professor Kuo Su Chen, which will be guided by Mr. Ahmad Nasri.
有，我们这边就是麦克风，这边都有了。
所以这样的音量是可以的。
对，可以的。
Right. So one more time, thank you to Taiwan International Healthcare Training Center for supporting this conference. Okay, well, ladies and gentlemen, now we are moving to the second session, the presentation from Professor Kuo Su Chen featuring Miss Tung Yu Chin. All right, just for time. So now let me keep in touch with the two speakers.
这是现场的主
Hello,
持
Mom.
人，
Hello, Professor. Have you been connected with us?
应该要打个招呼，可以挥挥手。
Hello there. Have you been connected with us?
哎呀，有看到。
Okay. Would you listen my voice right well? Yes? Do you listen my voice?
Yes.
Okay, okay. Right, so the second presentations will be delivered by Professor Kuo Su Chen, featuring with Miss Tung Yu Chin.
我们把它
Right, but before they deliver the wonderful presentation, so I will invite all participants and also speakers to join the
也
photo
会荧幕截图，
Now we will have a photo session together, Professor.
做好准备，它就会有两个在你们
Invite all
就一直对着荧幕笑，这边
director and also webinar participants to join the photo session together before the presentation.
.稍等一下，他们以后拍照会轮流有不同的人坐在你们的前面，坐在会场的前面，然后再拍一张。听得到？有，我们现在是开麦克风的。对对对。那声音是哪一个？
Okay, now ready for the photo session?
对，他们会轮流不同批的人去前面拍照。
1, 2, 3. Again, 1, 2, 3. Okay, maybe you would open your mask, please, Mr. Okay. So, 1, 2, 3. Again, 1, 2, 3. Last freestyle. Okay, freestyle. 1, 2, 3. Again, 1, 2, 3. Okay, thank you very much. And then I join all participants webinar to join for the photo session, please. I come to stage all webinar participants here. Please join the
所有人大家一起写，就是请他们露脸。
all speaker also please join for the photo session.
Mm-hmm. 所以我们总共是60还是70？总共是60分钟嘛，75还 QA，
还 QA 大概15分钟。对对对，如果讲的比较长 ，QA 就可以短一点点，选1、2个问题回答就好。
就是一直
Okay, we ready? Okay, 1, 2, 3. Again, 1, 2, 3. Freestyle, please. Okay, 1, 2, 3. 1, 2, 3. Well, all right. Thank you very much. Well, ladies and gentlemen, for the session 2, a presentation delivered by Professor Kuo Su Chen featuring Miss Tun Yu Ching from Taiwan. But before they deliver the wonderful presentation, let me give her a curriculum vitae of both. So her full name is Su Chen Kuo, or Kuo Su Chen. And then about her educations in University of Minnesota, USA for PhD in nursing. About work experiences of her is 2009 till 2013. She's a professor in National Taipei University of Nursing and Health Care. And then in 2011 to 2013, Director of Nursing Department in National Taipei University of Nursing and Health Service. 2011 to 2013, the Dean of College Nursing, National Taipei University of Nursing and Health Service. And then 2013 till present as an adjunct professor of college nursing in National Taipei University of Nursing and Health Service. And then about Miss Tung Yu Chin, now she is an assistant health nurse at Labor Delivery Ward, Changgung Memorial Hospital. Right, to save our time, now we will go directly for the presentation. Professor and also Miss, the floor is yours now.
Okay. Thank you.
Right.
应该是另外。你先讲吗？我先，你先讲，好，都可以。还是要你先讲，没关系，你先讲，那我这样就控制时间。好，我先讲。好，好，那我们可以开始了。对，直接开始。对，没有问题。
Thank you all for coming today. My name is Yu Jingdong,
and I am very happy to share with all the experience of taking care of pregnant patients. Frankly, with COVID-19 in Lincoln Chang'an Memorial Hospital, I am a nurse and a midwife. This is my teacher. She will assist me in the presentation. And this is my first time presenting in English. So please pardon my English. Thank you. I will talk about how to conduct antenatal examination, what the medical staff have to prepare for during delivery, including the instrument used and the mandatory work attire, and the educational course relating to COVID-19. I will then give example of case we took care of and make a summary at the end. This is the outline of my presentation. Before the pregnant patients arrive at the OPD, normal process, they first have to go to the registration desk and have their height, body weight, body pressure, urine protein, urine glucose level measure. They visit doctor. But during COVID-19, they are asked about their TOCC. If there is one of TOCC appear, near to confirm fevers, respiratory symptoms are identified, the answer is yes, and there are redirected to lead emergency department. If no, a phone call is made to the attending physician for promise to see the patient. If the physician declines, the patient is asked to go home and reschedule. If the physician agreed, the outpatient clinic setting has to be disinfected with 1,000 ppm bleach. This is the COVID-19 patient's risk assessment from office at the OPD. Then, list travel history, occupation, contact history, and the cluster history. It asks the patient if she has traveled within the past 21 days, her occupation, her contact history, where she has been such as the hospital or local clinic, and if her family, friends, colleagues have had a fever or respiratory symptoms over the past month, or if anyone has not need the isolation period. Next up, I will then talk about the changes we made during this epidemic prevention period. First, we implemented restricted access. The hospital closed off all of the entries and allowed only 2 entries for access in and out of the hospital. Body temperature, TOCC, hence disinfection are taken and done at the entries before entering Second, access to the delivery room was restricted. Medical personnel wore standard protective equipment and stayed at the entrances to screen the patients and the guests. Only the patient and the one caregiver is allowed access into the delivery room. All visitors were required to make an appointment on the hospital app. Aside restricting access, yellow and red room were banned. Red room were for patients who were positive for COVID-19 and were planned in the isolation ward. 11L. Yellow room were for those with high risk for COVID-19 or those who have not completed their isolation time. Allocation of staff was considered. The delivery room was split into observation area, awaiting delivery area, postpartum area, operation room. All nurses were limited to one area, and the patients are planned in the same room, from admissions to delivery and postpartum. Skin contact in 20 minutes for vaginal deliveries, and 10 minutes for cesarean sections before the newborns are sent to the baby room. Our hospital implemented guidelines and protocol on how to care for pregnant women during this pandemic. This is the guideline. If patients are suspected for possibly having COVID-19 or if they have no completed their numbers of days of isolation, they are sent to the emergency department if cesarean section is required. It is done on the second floor in OR 23. After the surgery, the patient is planned in the rain room. Those who require tocolysis or are awaiting delivery will be placed in the rain room, and all deliveries are made in the same room. A checklist made for all equipment and instrument required for delivery. After the delivery, the newborn and the mother are both transferred. The newborn is sent by the neonatologist and the nurse dressed in PPE to the designated red or yellow zone 2L. Mothers who need to go to the red or yellow zone are sent by doctor and the nurse dressed in PPE. Before sending the patient to the next unit, the medical staff are required to contact the security guard to control access to the elevator. There is someone stationed in front of the delivery room to screen off people who arrive. They'll take out the risk assessment form and inquire the pregnant patient and whoever accompanies her. The context of the form is the same as the form given at the OPD. This is a checklist made in the delivery room. There are high-risk cesarean section, standard cesarean section, and spontaneous delivery. Allow the delivery room nurse to prepare supplies according to the list. This is a checklist for high-risk emergency cesarean section. We prepare a set from neonatal care equipment, and the first aid supply. The second is a checklist for standard cesarean section, including equipment setting, material from surgery, for example, suture, gauge, medication, and the supply for neonatal care. The third is a checklist for vaginal delivery, which is similar to that for CS. Next up, the isolation rooms and the yellow room in the labor unit. I will use photo to introduce to help everyone understand. There is a mirror for staff to check if they are properly dressed and wearing a mask. This is a outside appearance of the ward. There are two doors. The door is closed at any time. This is the first door into the preparation room. We call anteroom. This is the ward after into the second door, and this is the bed. We start up a yellow zone in the delivery ward. The yellow zone consists of individual rooms with single bed. We require staff to wear proper PPE, which include a white waterproof isolation gown, latex glove, respirator mask, hairnet, and face shield. Let's see how we put on and take off the proper PPE and how to transfer the newborn. Protection can be divided into standard protection and PPE. This is standard protection used when we are caring for patients at a risk of infection, including hand hygiene, installation of gloves, water and wheelchair's waterproof barrier, PPE, such as underdress, respiratory mask, face shield, hair hands, according to the risk of exposure. Now we will present a video of how to wear and take off the personal protective equipment.
新传染病个人防护装备首先采消毒性洗手，摘除手上饰品及手表等，执行手部卫生，使用抗菌性洗手剂进行消毒性洗手，身形大小的防护衣，穿着前检查领口、拉链及双袖口有无破损。穿戴时注意防护衣的头套及袖子勿接触到地面。防护衣穿着顺序应由下至上穿戴，不戴帽。拉上防护衣拉链时，拉链插销确实下压，防止下滑。拉链旁之胶带勿粘贴。佩戴内层手套时，手套应确实包覆全罩式防护衣袖口。穿戴抛弃式防水长筒鞋套时，双手勿碰触鞋底，将防护衣裤管包入鞋套内。因穿戴抛弃式防水长筒鞋套时，双手易碰触到鞋底，应执行手部卫生，采酒精性干式洗手，洗手。佩戴 N95 口罩时，应选择符合脸型大小之口罩。佩戴口罩时，先将口罩鼻翼中间铁片稍微折弯，调整成杯状。口罩松紧带应固定于耳朵上下方。接着将鼻梁铁片向下压紧，使口罩与脸颊和鼻贴合。每次佩戴呼吸防护具应注意口罩密合度，执行口罩密合度检点方式，应将双手食指及中指置于口罩鼻梁铁片处，拇指置于下巴处，大口吸吐气，测试有无漏气情形。全罩式防护衣头帽戴上时，需完全包覆头发，不外露。穿着医疗用防水隔离衣，简称外层隔离衣。穿着外层隔离衣时，应检查领口及双袖口，确认无破损裂痕。颈部后魔鬼粘端应确实粘贴。腰部绳索以活结固定于腰侧。佩戴外层手套，手套应确实包覆外层隔离衣袖口。防护面罩佩戴方式：将防护面罩固定于额头部位，覆盖在防护衣帽上，面罩下方胶带勿粘贴。检视装备是否完整，由受过训练的观察者协助检视执行者的装备是否可完全包覆皮肤无暴露。执行者做伸展动作，确认活动时仍可维持装备可完全包覆皮肤无暴露状态。进入负压隔离病室前，进行酒精性干式洗手。进入负压隔离病室前，需先检视负压压力值是否于正常范围内。进入前室时，以不同手开关门，例如由左手开门，右手关门。开启门后，需于前室停留1分钟，方可开启下道门。接着进入病室时，以不同手开关门，如左手开门，右手关门。执行相关作业，依洗手时机执行手部卫生。防护装备脱除流程： 离开负压隔离病室至前室前，进行酒精性干式洗手。离开隔离病室，应使用酒精纱布包覆门把开门，以左手开病室内门把，侧身出病室，右手拉病室外门把，轻轻将门关妥。进入前室，双脚采漂白水毯消毒，双手同步进行酒精性干式洗手。脱除抛弃式防水长筒鞋套时，不可碰触鞋底，以碰触鞋套脚跟外侧往下脱除。进行酒精性干式洗手。脱除外层隔离衣及外层手套时，先拉除腰侧打结处。双手碰触外层隔离衣肩部往前拉除，以松脱颈部后魔鬼粘。一手碰触另一手手套与外层隔离衣结合处往前脱除，由已脱除外层隔离衣之手抓取另一手之外层隔离衣内层，隔离衣由肩上内部往下脱除，接着抓取另一手手套与外层隔离衣结合处由内向外卷起脱除。脱除动作应轻缓，避免抖动，防止污染。进行酒精性干式洗手。除防护面罩，抓住头带，由头后方向前脱除，避免碰触面罩前侧污染面。着内层手套进行消毒性洗手。离开前室，应使用酒精纱布包覆门把开门，以左手开病室内门把，侧身出病室，右手拉病室外门把，轻轻将门关妥。双脚采漂白水毯消毒鞋底。进行酒精性干式洗手。脱除全罩式防护衣头帽时，应注意不可低头，避免 N95 口罩碰触全罩式防护衣。将防护衣拉链往下拉至底，不可碰触全罩式防护衣内侧。进行酒精性干式洗手。脱除全罩式防护衣头帽，碰触连身隔离衣之头帽外侧，由前往后脱除。进行酒精性干式洗手。脱除全罩式防护衣及内层手套时步骤：双手碰触防护衣外侧肩部处，往后往下拉动；一手碰触另一手手套与防护衣结合处，往前脱除。衣袖与手套一并脱除。脱除防护衣之手，碰触另一手防护衣内层，抓取另一手手套与防护衣结合处，由内向外卷起脱除。衣袖与手套一并脱除。脱除顺序由内向外，由上到下，动作应轻缓，避免抖动，防止污染。进行酒精性干式洗手。佩戴医用检查手套。脱除 N95 口罩，以双手抓取下方松紧带，再连同上方松紧带由后往前脱除，勿碰触口罩正面污染处。进行酒精性干式洗手。脱除手套时，第一只手套直接由外侧脱除，另一只手套应由内侧脱除，避免污染双手。最后进行消毒性洗手，即完成脱除防护装备。
Okay, we presented this video for you because we want to let you know in our hospital we all have this SOP, standard operative procedure, and we need to train our staff to familiarize all this process step by step and to protect themselves and also protect our cases. So it's very important in the hospital to help our staff to feel security.
Okay, this is how to clean the face shield. First, put on the mask and the glove. Use alcohol wipes to clean the shield. Then, dispose the wipes into the designated garbage can. During delivery, neonatal care is done in the anteroom, and the protective gears is required in outside anteroom or preparation room. The wearing status of PPE is the same. Before sending the newborns to their unit, hands have to be disinfected. Out of the anteroom, the outer layer of isolation gum and the glove and the face shield taken off. Then wear a new face shield and transfer. After arriving at the destination, take off all protective gears in the anteroom. Then take off the face shield, isolation gum, glove, respiratory mask, and disinfect your hands again. Next up is training to medical staff. We continue to provide training to medical staff on topic about COVID-19. Also practice putting on and taking off protective gears to raise awareness. They are putting on the isolation gum. They are taking off the isolation gum. Postpartum care is limited to the patient and her caregiver. Run-in is forbidden during this period, and no visitors are allowed to see the newborns. If mothers are asked to go to their babies for feeding, hands have to be disinfected and mother has to put on isolation gum before feeding their babies. This is a case that we took care of. Mrs. Wang is 32 years old, without TOCC, G1P0, with an EDC on April 29. Due to preterm labor and vaginal bleeding on March 1st, she was admitted for tachylysis. On March 5th, she suffered from shortness of breath, so chest X-ray was done, which revealed right low and low pneumonia we contacted the Department of Infectious Disease, and the doctor there recommended. Then we do a screen and report to the CDC. We follow our protocol and send the patient to the isolation ward on 11L and took a screen test. The patient's shortness of breath wasn't in 1 day, so cesarean section was arranged. After the baby was delivered, he has transferred to the isolation ward on 2L. The mother was upset until March 7th, and the screen results came back negative. So she was transferred to the postpartum ward. The baby also had a negative screen result on March 6th. So he was sent to the NICU for further care. Last but not least, I would like to share my thoughts on this period. COVID-19 is rapidly going pandemic and has changed the entire world. Taiwan has done many pandemic prevention policies, and we have done a great job of capturing global attention. At first, I was uncertain how to face patients suspected of COVID-19. I encountered suspected cases who were under tuberculosis or those who underwent CS. Even when we were working as a team between different specialties, wearing protective gear, and being in the same isolation room, we all had the same concern from the pregnant patient and for any turn of event that could happen. We gave each other support because we knew we were a team and then we were in this together. The trust land we built together grew stronger day by day, and we told ourselves that we could overcome this pandemic if we work together to fight the COVID-19, because to help save life is our mission. Thank you all for listening.
Right, that's the wonderful presentations of two speakers, Professor Kuo Su Chen and Miss right, and Miss Sung Yu Chin for the wonderful presentation. One more time, give one big applause to both speakers, please. Right. Okay, to comprehend our understanding about the presentations, I will invite directly the participants for the discussion session or question and answer sessions. Okay, so for the webinar participants, if you have any question, and also the audience here to join the question and answer session. So we will go directly to the question and answer session, Professor.
Excuse me?
Yes.
Professor Kuo haven't done her presentation yet.
After the presentation,
Yeah, there's still one more. Yeah.
Oh, okay.
Yeah.
Okay, so
they just write down the question, and after my presentation, we will do the Q&A together, okay?
Okay, I would say sorry. Right, and then, okay, I will give you the floor to continue your presentation, Professor. I was really sorry for that. Okay, so the floor is yours now.
Okay, thank you. Thank you for inviting me to join this conference. It's my honor to share with you about the maternal health care during COVID-19 in Taiwan. So this is the outline for today. I wanted to share with you about this COVID-19 pandemic. At first, you will see this table. This is a recently international statistic about the COVID-19 cases, total cases, and total death, total recovered, and active cases. So you will see your country and Taiwan. And there is a little big difference, but I want to just share with you how we done and how we process in the hospital and in the local for face this pandemic. Okay, so because Taiwan geographically is very close to China, so Taiwan was predicted by Johns Hopkins Hospital and University to be one of the nation's hardest hit by COVID-19 due to its close interaction and proximity to China. However, Taiwan has drawn the right lessons since SARS outbreak. It is proven itself not only self-reliant, but also capable of helping other countries in line with the International Health Organization to fight against COVID-19. Taiwan takes credit for its effective response to COVID-19, and nearly 80% of cases were imported. The management of the pandemic crisis is widely believed to be a blueprint for many other countries. Taiwan's success did not come out of sheer luck. Instead, because in 2003, we have the SARS outbreak. So we learned a lot from this past experience. And after that, the government reorganized medical care system preparedness and the public engagement. So because we, in 1971, we are withdrawn from the UN. So we have to rely on ourselves to overcome every problem, and also including natural disaster and serious epidemics for nearly recent 50 years. As a result, its government has learned to devise a more effective organization for epidemic prevention with more efficient mobilization of medical personnel. So in January, the outbreak of COVID-19 2020, we knew that a new and unknown respiratory disease emerging in Taiwan. So we first intermissed the Central Epidemic Command Center was concurrently activated and pulled a series of key measures for blocking transmission and effectively stemmed the spread. So all this audit must be completed under the supervision of infection control experts. Every 4 years, all hospitals are required to be officially accredited by the Joint Commission of Taiwan, a non-profit for-profit professional accrediting organization, to ensure all the necessary infection control personnel, equipment, and reserve stock are in position. So when the government made the announcement in January, the hospital were able to activate immediate measures such as triage, quick isolation, strictly control crowd flow, medical task force, and epidemic prevention material to maintain the normal operation of medical care system. So, familiar designation in the medical care system that happened to other nations has never occurred in Taiwan. In contrast, Taiwan medical system helped successfully in treating serious cases of COVID-19, and the death rate goes much lower than those of the nations with advanced medical technology and the universal health care coverage. So more importantly, the success of the epidemic control has resulted from the post-SARS self-alert and the self-discipline of the residents to voluntarily put on the face mask, wash hands properly, and practice social distancing. Another contribution from the public is the wide application of big data analysis and advanced information and communication technology, advocated by the government as well as on social networking. Communication technology has been applied broadly to various prevention measures. For example, from the National Health Insurance Card, physicians can check out patients' overseas travel history and whether they are still required to stay home or quarantine or isolation. In addition, residents are able to search on their mobile phones which pharmacies in the neighborhood to go to for the purchase of surgical masks and what appointed time to keep up the mask in the given quota. Recently, convenience has ended to online shopping from home and at the convenience store to shorten time for clearing up for the purchase. In Taipei, for example, residents can even buy masks from vending machines. With the joint efforts of all the residents, Taiwan is one of the few countries in the world that have not imposed a lockdown on any city. Residents are able to go to work, study, and perform daily economic activities as usual. Taiwan is also the first country where the professional baseball league resumed play. Ongoing effort, although it has been days without any confirmed indigenous case in Taiwan, the condition in the neighborhood country has been closely watched by Taiwan as any negligence might trigger another outbreak. To prevent the second wave of infection, either caused by imported or by indigenous case, the government and the health provider continue to be on guard. While residents are resuming their normal life and the regular economic activities, the government and the medical experts request all residents to shrink from crowded places, to keep social distancing, and to maintain strict control over port of entry inspection. More importantly, Taiwan needs to collaborate with research institutes in other nations to develop vaccine and a new drug as part of the preventive strategies against the next wave of the epidemic. So successful control measures in Taiwan include effective leadership with complete nation coordination, strong infrastructure and information technology, advanced planning and deployment, transparency in policy making with clear public guidelines, smart testing for potential COVID-19 infection with meticulous tracking and strict isolation and the quarantine of infected individuals. So, Central Epidemic Command Center activated on January 21st. So this CECC, the effort to aid an individual resident overseas travel history, access relevant information, implementing travel restriction. So to prevent the storage the PARS universal access to surgical mask was implemented in February 2020. Okay. Through this central coordination of increased production of surgical 925 N95 masks and the peace control, although medical masks were prioritized for health professional and the medical facilities, the remainder were rationed to the public at a low cost. Given this context, we would like to share our experience from one hospital. This hospital is in Taipei City, and then the maternity unit is the baby-friendly hospital certified by Taiwan Health Promotion Administration. So the hospital instant command system was established on January 23rd. The director of the hospital chaired daily meeting to discuss the ongoing pandemic and the plans and strategies in response to update from the CECC. So the measures implemented to prevent the spread of COVID-19 have included established specialized ward for COVID-19 patients in a separate building with designated walkways and a separate elevator entrance. Setting up outdoor fever screen station to prevent individuals with suspected fever entering into emergency rooms. Having one in distinguished entrance open per building and assigning personnel to monitor entrance 24 hours in a day. Everyone entering the hospital has to pass through the infrared thermometer. Those identified with a fever are directed to a fever screening station. And every person entering the hospital has to provide proof of identification and complete a self-health declaration form for COVID-19 prevention. This requires individuals to document any symptom, including fever, cough, respiratory distress during the previous 14 days, and their overseas travel history. So a nurse led risk assessment of patient using a Prof developed by the Infection Control Unit, including document and the individual travel history to DOCC. The information provided is verified using a VPN linked to the National Health Insurance Administrative Database. So this is the risk assessment, DOCC assessment. This is from the CECC, okay? To share with you how we do this form for assessment. Okay, the situation of maternity in Taiwan. More than 99% of births are delivered by obstetrician and take place in hospital. The maternity unit is staffed by nurse midwife and the nurses include, like this hospital, the bed, the nurse, and the special care unit. So there are around 110 and 40 births each month. The usual inpatient stay of 3 days following a vaginal birth and 5 days following a cesarean section has remained unchanged during this pandemic. So the obstetric gynecology and neonatology clinical teams met on January 26 to discuss strategy to prevent COVID-19. Following the meeting, change including only allowing two visitors per woman to visit anytime, preferably close relative, including her husband or partner, and the mothers, have to provide proof of identification. One of these two named visitor can stay overnight with the woman. In circumstances for more than 2 visits are permitted to see the woman or her baby. To prevent the possible transmission of infection, rooming in and breastfeeding are temporarily halted, as the baby will be transferred to the nursery and feed the woman's expressed breast milk. No visitor can enter the nursery, but the visitor can see, hear, talk to the baby via telephone or live videos. Visitor management measures in these cases include prioritizing woman's husband or partner before other relatives. Any other children the woman may have cannot visit while she are inpatient. Visitors have to wear surgical masks all of the time and adhere to strict infection control rules, including TOCC report, VPN verification, complete a self-health declaration form, body temperature measurement, hand washing, and they can only access designated corridors and entrance-exit walkway. If a pregnant woman is diagnosed with a suspected to have COVID-19, she will be moved to an active pressure isolation ward, and the birth will take place in an active pressure birth room. Any woman showing signs of fever, tremor, headache, and diarrhea in labor will be assessed by a doctor and have a SARS-CoV-2 test if needed. The symptoms such as fever and upper respiratory symptoms are identified in a postpartum woman. She will be moved to an isolation room assessed by an infectious disease specialist and the test for SARS-CoV-2 with a repeat test 20 hours later. Her infant will be admitted to an isolation area in the nursery until the maternal test results are negative. There is no fever, and the woman has received a full clinical assessment. Advice on breastfeeding, rooming, postpartum exercise, postpartum nutrition, contraception, and resume sexual intercourse, all this health teaching are now offered to women individually at their bedside, rather than offering group classes, because previously we have a group teachings for this topic. The unit is no longer accepting sitting the meals provided by external companies, and the meals now have to be provided by the hospital or the woman's relatives. Because in Taiwan, we are emphasize the postpartum sitting the months. During this month, the woman has a special meal and then have a more rest. So they allowed special food. So now it's stopped. And so the public area in the sitting room, in the maternity unit were closed to prevent people gathering, and then the unit has only one entrance open. Half of the sitting in our public area in the unit were removed to maintain social distancing. According to the tradition, okay, I just say this. Women are discharged home will be advised to avoid public and crowded places. Maintain social distancing and wash their hands frequently, similar to advice offered to the general public. There is anecdotal evidence that postpartum women are much strict about avoiding close contact with the visitors and keeping the number of visitors to a minimum. Hospital policy toward the staff measure their temperature every day. Individual football symptoms include fever, sore throat, upper URI tract infection, diarrhea, must stop walking immediately and attend the fever screening station where they will be tested for SARS-CoV-2. So official leave is granted. The Hospital Occupation Safety and Health Center will follow up the staff member, and she will test the result will be assessed. Who can sign a return to work permit when appropriate. Okay. Increasing the environment cleaning and the disinfection from 1 to 3 times a day was also introduced, using disposable clothes and 0.6% ppm bleaches for cleaning. Infection control unit of the hospital oversees the monitoring of environmental safety. So also do the in-service education for the staff. And in Taiwan, Association of Obstetrics and Gynecology, they developed the guideline SARS-CoV-2 interim guideline for the treatment of pregnant and labor women during the epidemic. It already has a third edition because this guideline is provisional and its content may be revised due to change in circumstances. And the process of employee carrying service during COVID-19 from another hospital to show you how they carrying their employee. This is the flow chart in their hospital, how they provide the caring for many routes like line, telephone, email, to present the caring for the hospital staff and also do the spiritual needs assessment. And when they require, they will do the refer. So inclusive, we consider that effective preventive and the control measures introduced at the government and the hospital unit level have minimized the risk of COVID-19 infection to women and their infants. In general, frontline clinicians have not experienced a serious concern with patient service users or visitors. This could be due to clear public guidelines and the communication issued by the CEE with information about the hospital policy on website, electronic notice boards, and the poster at all entrance. Only a few many related visitor restrictions have been reported. So we're working together. We can overcome the pandemic of COVID-19. Thank you for your attention. So if you want to go alone, fast, go alone. If you want to go far, go together. Thank you again. Bye-bye. Any question?
Okay. Right, that's the wonderful presentation from Professor Kuo featuring Ms. Tung Yu Chin. Professor Kuo talking about the maternal health during COVID-19 in Taiwan, and also Ms. Tung Yu Chin talking about maternal care experiences of Lin Ku Chang Yang Memorial Hospital during COVID-19. And right, for the comprehensive, a wonderful presentation from Professor Kuo and also Ms. Tung. Now, I will invite all webinar participants to join the question and answer session directly. So if you have any questions from the webinar participant and also the audience here, please join the discussion session. Is there any questions? So we will go to the discussion session directly, Professor. Is that okay? Professor?
So let's just based on this question.
Yeah, I will open the question and answer.
Okay.
Okay, right. Okay, is there any questions from the webinar participants? And then here. Okay.
Any question?
Okay. Yeah, so we have questions from the webinar participant, Professor.
So what's the question?
Yeah, let me read the questions.
Yeah, please. Yeah. What's the question?
We have one question from the webinar participant. And the question is, Okay, first questions. So, how to decrease or prevent for a newborn from COVID-19 contamination? So this is the first question, Professor. How to decrease or prevent for a newborn from COVID-19 contamination? Okay. So to Professor Kuo, would you please give your answer about these questions?
Okay, so the first question is how to decrease or prevent for newborn COVID-19 contamination. You mean that? Okay,
Yeah.
so it depends on this. It will related if that first, I think we need to assess is the mother have been infected. Okay, so if mother is suspected, so we will do this if the mother and the baby were separated after the birth. And then the baby will take care by the specialists of pediatrician, and then also put in another isolation room. So we will take that individual one by one care, and to prevent to contaminate to the other baby. So that was separate, isolated. Okay, it's okay now. It's
okay.
Is that answer okay?
Right. So thank you for the wonderful answer and explanation from Professor Kuo. Hopefully, someone who asked can understand very clearly. And is there any more questions? Is there any? Yes? Okay, so someone who asked streamingly, okay. Is there anyone more questions from webinar participant? Yeah, someone who raised hand. So please, okay, I give you time to ask your questions.
Okay, thank you, Prof. Kuo. I think this is an interesting presentation. I would like to ask how to, what is it? What is the best way if the baby and also the mother got COVID-19 and they must have isolation in a hospital, must be in a, in a isolation room. So what should the mother do? Because the mother have to give breast milk to the baby.
Okay, so if I can repeat the question is, what should the mother do when the mother and then the baby got the COVID-19? So what should be done by the mother in the isolation room? If I'm not mistaken, like that, Professor Kuo, would you give the explanation answer about this?
Okay, you mean for the because separated the mother and the baby, and how the feeding issue is that right? Ask about it. Yeah. Okay. So if the mother and the baby are separated because in a different maybe negative pressure room or isolation room, so it depends on the condition of the mother and the baby. So we encourage the mother express the milk. We feeding the express the milk. Express the breast the milk. Is answer? May I answer your question?
Yes, but then in your presentation, if I may not forget that, one of in your slide, you have explained there is a special cloth for the mother, if I'm not forget, for the mother who will give the breast milk to the baby. Is it right? I mean the cloth in a isolation room. Is there any special cloth if the mother wants to give breast milk to the baby?
Yeah, maybe I can repeat the question. So, is there any special clothes for a mother and a baby in the isolation room because of the COVID-19? That's the question, Professor.
他刚刚你的 PPT 里面不是有一页说，就是如果好像是妈妈如果有穿一件特殊的衣服就可以进去，还是怎么样？那这样就不行，那你就跟他说，就是要隔离的话，就是所有人都不能进去，对，就只有医疗人员。
Because if we were suspected cases in the NICU pressure room, so that's just what we will have one nurse enter to a room and then put all the protective equipment to enter to a room, so cannot have another visitors. Is that answer your question? Or
right? Okay, to someone's who asked, does it answer the questions? Oh, okay, yes, right. And we will move to the another questions. So I will invite all webinar participants. We still have one more question, Professor. Okay.
Okay.
Right, and then the question from Ibu Islami. The question is how to start breastfeeding for mother who diagnosed by COVID-19. One more time. How to start the breastfeeding for mother who diagnosed by COVID-19. So maybe how to give the breastfeeding method when the mother is diagnosed by COVID-19. So that's the question.
So I think that the important thing is when does this case is diagnosed. If we diagnose during the last trimester, then we can teach the pregnant woman how to express the milk. But so if that's just all, we discover the case during the labor period, or that's another issue, okay? So that after birth, we will teach how to express the milk. So all this is, we temporarily halted the looming in. So we separated mother and the baby in other isolated or negative pressure room. So we do express the milk, express the breast milk. And then we need to let the mother understand the situation, how to do this. We concern her and then we do more caring about this process. Okay, may I answer your question?
Yep, so to Ibu Islami, does it answer the questions? Okay, yes. And is there more questions? Is there any more questions? No? Okay. Okay, seems like we have no more questions. Professor Kuo and Ms. Tung Yu Chin, maybe we can understand the material very clearly. And once again, I will close this session. But once again, I would say thank you very much for Professor Kuo and Ms. Tung Yu Chin. So now please give an applause for both speakers, right? And before I close this session, maybe I will give Professor Kuo to give your closing statement. Professor, please.
Oh, thank you for joining this wonderful conference. And I also, during this preparation, I also now learn a lot from my preparation. And it's a great honor we can share with you how we do in Taiwan, and from the central government, the local hospital, and in the public. I think it's very important. All the people working together, cooperation, and then we can overcome this pandemic. Hope you, Indonesia, also can overcome this disaster. Thank you so much.
Right, thank you very much one more time to Professor Kuo featuring Ms. Tung Yu Chin. I'll see you for the next webinar. Okay, so I must close this session and then we will go directly to the session 3. Okay, before I go for the session 3, I would like to say thank you one more time to Taiwan International Healthcare Training Center to support this conference. And thank you for the collaboration. Now I will go directly for the session 3. The presentation delivered by Mrs. Umi Faridah. Now let's me keep in touch with the third speaker, Mrs. Umi Faridah. I let you to come to stage. Okay, so to save our time, we will go directly to the third presentation from Mrs. Umi Faridah. How are you today, Miss? So far, so good. Okay.
Okay, I feel nervous because I'm last the speaker here.
Okay, right then. And so, Miss Umi Faridah, today we'll talk about nutrition or child nutrition. Before she deliver the wonderful presentations, let me introduce her for a while. Okay, so her full name is Umi Faridah. She was born in Demak, Central Java, Indonesia. And then for the educational background, she completed the bachelor degree of Department of Nursing, Asia Health Science College of Yogyakarta in 2004 till August 2008. Then she continued for the professional degree, Department of Nursing, Asia Health Science College of Yogyakarta also in January 2009 and December 2009. And also she completed the master degree in Faculty of Nursing Science of KC University, Bangkok, Thailand. Okay. And also about the work experiences that I can mention one by one. There are so many work experiences, but at least in 2016 till present, so she works in Muhammadiyah Health Science College of Kudus, Department of Nursing, Kudus, Central Java, as the head vice of nursing diploma program. And then now 2010 till 2020, she works in Muhammadiyah University as a lecturer of family and community health nursing, pediatric nursing, and maternity nursing. Right. Okay, to save our time, so we will go directly to the third presentation delivered by Miss Umi Faridah. The floor is yours, ma'am.
Okay, thank you for the chance to presentation today. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And good morning, everybody. Still morning, right? Because I think it's almost 12 a.m. but still morning. Okay. Okay. First, my honorable Rector University of Muhammadiyah Kudus, Dr. Candidate Risnawati, Master of Epidemiology, and then my honorable special speaker from Taiwan, Prof. Kuo Su Chen. I think I'm not a false spelling, and Miss Tung Yu Jin. Okay. And then my honorable, my friend speaker today, Miss Indah Risnawati. She make a good presentation today. And my honorable, all of the vice rector of University of Muhammadiyah Kudus to support us about this event. Okay, and then my honorable, the dean of Health Science Faculty, and then my honorable, the dean of Faculty of Science and Technology and Faculty of Economic Education and Law, and then my honorable, all of my friends to attending this event. And then the last, thank you very much for all of the participants to join this event by online via Zoom. Okay. Here I would like to share about the again standing in pandemic era. Okay, in this session, my presentation will be share about the introduction and then continue with the stunting effect and factor of stunting And then about the regulation of stunting in Indonesia, I think is important thing. And then the last about the key areas to intervention of stunting. This is the area to take more attention when we want to decrease the stunting number in Indonesia. Okay, and pandemic era, I think my friend, the first speaker already mentioned about the update cases COVID-19 in Indonesia, and then I didn't tell more about that. Okay, sorry. This is about the stunting in the world that I read in some book or some literature. I found that the rate of stunting is still high and is the focus of world attention because the high cases of stunting and then the world make stunting like some problem in the world. Based on the data from Food and Agriculture Organization about the 870 million people out of 1.7 billion people in the world, 1 of 8 people in the world suffer from stunting. Is the high number of stunting in the world. Most of them is about the 852 million live in developed countries. It's like countries in Asia, like in Indonesia. Okay, and then according based on the WHO, stunting cases of 54% of infant and child die. The result of the WHO consensus show that 49% of under 5 years old death in developed countries are related to stunting. A lot of children under 5-year-olds dead because they got the stunting in development country. Okay, we take a look at the picture in this slide. We can see a lot of the color like red or orange is about the stunting in the world. I got the stunting in Asia is about the full color red and orange. Okay, like in Indonesia, we got the full color. Many island in Indonesia got the stunting based on the data from WHO. Okay, and this is the graphic of stunting that I mentioned before. Half percent of stunting is in Asia. Okay, and then 30% of stunting children under 5 years in Africa, and then 20% stunting children under 5 years in America Latin. Okay, okay. And then according to UNICEF, the number of stunting children in Indonesia ranked 5th in the world. Is so quite worry about me because in Indonesia we got the 5 rank. I think it's more wow because in the world a lot of country, but we got the 5 rank in about the stunting. Okay, and then this is the estimate that in Indonesia children under 5 years are below average in height. Stunting is like skinny and short. Okay, and then about how data from the Rizka in 2019, the stunting rate in Indonesia has decreased by 3.1. So feel, oh, we get the good news. We get the decrease of the number of stunting in Indonesia. Okay, and then I will go to the specific place like in Central Java. Based on the data from the Central Java Health Office, the prevalence of stunting under 5 years old in 2018 was 30.8%. Okay, and then this is data when we got the children 5 under year old. And how about the data with the children with the 3 years old, we got the data, but the 29.9% in 2019 is called in Indonesia in balita and baduta. Okay. The specific regency in Central Java is in Kudus. Based on the data from the health office in 2019, we got the number 68.707 people with the number of stunting. It's quite a lot about stunting in our regency. 8.07%. And then when we take a look about the target of WHO, WHO have to standard how about the stunting is less than 20% stunting. Is Indonesia have less more than the target of WHO. Okay. Okay, and then this is about the stunting of effect. I think when the children or get the stunting, they feel impact. Like a lot of literature mention about the stunting of impact is low cognitive level. I mean here when children get stunting, they feel cognitive low, or they can low memory something that they do every day, because as we know 500 years old is the period, or we call golden period, is that children grow and develop in every day. When they stunting, they feel low cognitive level. And then the second one about the stunting effect is lower intelligence level. Is I think when the children they get the stunting, the IQ is for a low. And then the third one is bad psychosocial. I think why stunting can make impact bad psychosocial for the children. Okay, for example, when the children come to the kindergarten and then they take a look with their friend and they feel, oh, why I'm so short, why I'm so teeny, they feel so bad feeling. They feel like low confidence. This is why the impact of stunting make a bad psychosocial for the children. Okay, and then the impact of stunting, the last is low motor. I think a lot of children, they have hyperactive, like she want to jumping or working every day or running everywhere. But when the children got the stunting, they feel slow motor because they feel fatigue or they lost the energy. This is the impact of stunting for the. This is the factor of stunting. I think a lot of the factor that related stunting that I read in some literature. The first is dietary intake. I mean dietary intake here is when the children, I think they feel, I don't like a food, I don't like this, I don't like this, gitu. So this is can make dietary impact is not support for the body, because a lot of children, they have more activity, so they need to support more energy and support more food to take their body. Okay, it is the first factor that related about the stunting. And then the second one is maternal nutritional status. It's quite lot of factor, a lot about, because the children, this is related or near every day with the mother. If the mother didn't get the nutritional status, it will be stunting. It's if pregnant woman, if they didn't get more of food or nutrition, and then I will they deliver their baby, they will got the stunting of the baby. Okay, and then the third one is social economic status. Okay, because we mentioned before, stunting, a lot of stunting in developing countries. So when we take a look, the family, they didn't enough income, they will be didn't enough to buy some food. I mean, it's feel when we didn't enough, we didn't get more energy, and then they feel the children and stunting. And then about the micronutrients deficiencies is the one of the factor of stunting. Okay, and then the next is about infection. I think a lot of area we got the infection like condition here, we got the COVID-19 virus. This is like infection, but children is one of the vulnerable person that they have high in risk to get the infection. So we keep to children to have vitamin or some supplement to have a high antibody or immunitas. And then the last one, that factor related about the stunting in is environmental. I mean here is about the environmental condition when the children come to the kindergarten or some like their family, they didn't have a good condition like a lot of garbage, or maybe they live near some voice on, and then it's not support their condition. Okay, thank you. I think it's better. Okay, this is about the classification of stunting. Before we got the stunting or not with their children, we should to know about the height and age, because we can formula about the height based on the age, and then we take a look about the Z score. When this Z score is less than 3, it means the very short, is very tiny and very short. And then if the Z score is -3 SD until less than -2 SD, it will just short, not the very short. And then when Z score is -2 SD, it be normal. Okay, and then we next slide about the regulation of the Ministry of Health number 39 in 2016 concern guideline for implementation health Indonesian program with family approach. The effort made to reduce the prevalence of stunting. This is the regulations in Indonesia to make a decrease of number the stunting. They focus to the family approach because family is the near with the children. I think every day or maybe whole day the children with the parent or with their family. So this is why to be to decrease the number of stunting in Indonesia. Okay, there are two minds of the regulation in Indonesia. The first one for pregnant women and childbirth. This program is intervention in the first 1,000 days of life. After the mother deliver their baby, we have the program to intervention about the decrease of the stunting. And then the second one is strive to integrate quality insurance of antenatal care. It is the point that Miss Indah Risna mentioned a lot of the antenatal care is very important thing to pregnant woman and to to decrease the stunting in Indonesia. And then the third one is increased delivery in health facilities. I think this program that mentioned when we women want to deliver their baby, they go to the facilities, health facilities near their home. And then organizing a high calorie protein and micronutrient feeding program. I think it's program for childbirth when the baby grow up, then they need more calorie, they need more protein, they need more vitamin to grow up well. Okay, and then early detection of disease, infection or non-communicable disease. It means the program for to early detection, because we know the pregnant woman and childbirth is the vulnerable or high risk of the infection. We to take a look more attention about the pregnant, because like some women pregnant with the hypertension is like high risk to deliver the baby. And then eradication of worm, I mean is every month we got the like obat cacing di Indonesia. Jadi every month no I mean 6 months we get the obat cacing from the Indonesia. Okay, and then increase the transformation of kartu menuju sehat atau KMS into the handbook atau buku kaya. This is program to report of the history of the woman pregnant and their children. This is the book we got all of and complete information. We want to see how condition the pregnant woman or children. Okay, and then the last program for woman pregnant and childbirth is organizing early breastfeeding atau di Indonesia disebutnya dengan IMD and counseling exclusive breastfeeding. I think a lot of hospital here we should to be IMD for the mother, and then after that we should to make atau to give information about the purpose of the exclusive breastfeeding for the baby. Okay, I think quiet fast. Okay, it's okay, kan? Okay, and then the regulation for the toddler from the government Indonesia is toddler growth monitoring is important when the stunting they didn't get well about the grow up and development their skill, like the children for example, when I take a look the children 2 years old, they cannot work well because they are the stunting. This is we should to take monitoring, to take monitor, to take evaluation about the growth their children. Okay, and then organize early stimulation of cell development. Okay, and then organize supplementary feeding activities for toddler. I think in Indonesia we already and continue every month to this program. Like in Indonesia kita sebut posyandu. Jadi in this program government to support supplementary feeding for the toddler or children. And then the last is providing optimal health services. I mean it's a lot of health facilities have to support or provide toddler or woman pregnant well. Okay. Okay. And then the next slide is about the key areas suit intervention of stunting. I got the literature from the WHO. They mentioned 4 areas or 4 domains to take intervention more about the monitoring health inequalities. I mean, in Indonesia, not a lot of people have enough income to go to the good facilities, because in Indonesia we have a lot of the island and we have a lot of the rivers. Maybe some family they live in around the river, so I think it's not good to come to the good facilities. Okay, this is we take a look this area, because stunting is near there, near the remote area or rural area. And then about the hygiene condition, clean water in infection. This is the area that related to increase the number of stunting. When every day we use the water to everything, like washing, like drinking or cooking on everything, but when we didn't get the clean water, I mean it not well in our condition, in our body. Okay, and then social protection and food system. This is about the food system is like government make apa ya istilahnya, to method that to distribute the food for the stunting. Okay, okay, this is for individual factor. I think is Miss Indah Rizna already mentioned about this individual factor like early marriage and pregnancies. This is in Indonesia, I think some area have to early marriage, lagi pernikahan dini, itu akan make individual factor that we want to give the intervention to decrease the stunting, because when the teenage they get more married and then get the pregnant, it will be a risk to take stunting. Okay, I think is, and complementary feeding. This is I think not the complementary feeding that we need, but we need to make a creation how a family or mother support their food in their children. Okay, this is implementation to address child stunting. Energy and protein supplementary for women. I mean is for women, when women to get the pregnant, they will support to good energy and protein during they are pregnant. And then community-based platform from the nutrition education and promotion. I think nurse or midwife every day they give information about the nutrition and about the to take care about their health. And then government commitment and focus on equity. I mean, a lot of the programs should be commit to do every years, not to, oh, okay, this is I already finish and then I don't want to continue. No, this is government should to commitment their program. Okay, I think enough in my presentation today. I'm so sorry when I so like papa gitu, because I cannot slow when we transfer the information. Okay, thank you very much for your kind attention.
Right, so one more time, give a big applause to Mrs. Umi Faridah for the wonderful presentation. Okay, yes, you talk in a very clear about stunting accidents. And right now, to comprehend our understanding about this topic, so I would invite once again all webinar participants to join the question and answer session. And also the audience here, please join the discussion session if you have any questions. please raise your hand and then ask your questions. Okay? Is there any questions? Audience here? No? Okay, right. So, question from the webinar participant from Amalia Rahmawati. The question is, one of the way to solve if the children's under 2 years old don't want to eat, and for picky eater children, the parents give the vitamin every day. Is it good for them to give the vitamin every day? And then second question, we know that vitamin is in a drugstore or in a pharmacy belong to the chemical one. So that was two questions from Bu Amalia Rahmawati. Would you please give your explanation about this?
Okay, thank you for the question, Miss Amalia. I think you have the children 2 years, under 2 years, right? Okay. As we know, children under 5 years old is a golden period that they grow up well on their stage. When they didn't grow up well, it will be impact in the next stage. And then the characteristic of the children, like she will choose some snack, like I don't want it, I don't want the fruit, I don't want to eat vegetables, and then they choose some snack like the ingredient I think not well, not good for their body, and then we choose the supplementary food or vitamin to support their body. But when we got the vitamin is from the like drugstore or pharmacies, or some the like is more chemical, yeah, and then it's not good when we give our children more chemical. And then how to choose how to give the pure vitamin, right? Is we choose the vegetables or fruit that the children like. For maybe the children or the children have the favorite fruit like carrot or some vegetables. I think the mother can give some fruit or vegetables to support their vitamin. Okay, I think my explanation.
Right, so that's the wonderful answer and explanation from Mrs. Umi Faridah. Hopefully the questioner can understand very clearly. Okay, moving to the next question, please. Is there any more questions from the chat room questions? No more? The audience here, please joins the question and answer session.
I think because we almost go to the lunch.
Okay,
and then,
so this is the lunch time. Yeah, they get stuck. Or maybe they are starving.
Lunch time.
Right. So, okay, I ask one more time. So the webinar participant for this conference, if you have any questions, please just raise your hand, or you may write in a chat room. Is there any? The audience here? No more? Hello, everyone? No questions? Okay. So it seems like we are really clear about the explanation for the wonderful presentation from Mrs. Umi Faridah. So now please give one more time big applause to Ibu Umi Faridah for the wonderful presentation. Right. So before I end this session, I will give the turn for Ibu Umi Faridah one more time to please give your closing statement, Mom.
Oh, okay. It's about the something. I think it's about when the country to be the to when the country want to have the good generation. I think we take more attention to intervention to something early before pregnant woman or they after they childbirth. We got to take more attention, and then we will get the great children, and then we will get the great country. I think it's more quite when we take care our children, and then I will care with our country. I think because children is the period that we need to support more, because this is the our new generation in our country. This is important. Okay, thank you.
Okay, that's the wonderful closing statement from Ibu Umi Faridah. One more time, give a big applause, and I will say thank you for Ibu Umi Faridah for a nice presentation today, and we will see you soon in a next webinar series. Okay, thank you, Ibu Umi, and seems like we finished all international webinar series that we have, and well, ladies and gentlemen, now we are in the end of the international webinar series, along 1 month of 4 series of international webinar series. Before I close all this webinar series, I would say thank you to all members that joined for this webinar. And then I would like to say for the first time, say thank you to Mr. Risnawati, a doctor candidate, the rector of the university, who really support for this international webinar series. And then I would like to say thank you to Mrs. Ani Rosiana Masito, a doctor candidate, a vice rector of Students Affairs, who really support and give the motivation to us to conduct this webinar series. And then I would like to say sorry to Ibu Woro Yunitatri Mukti, the really good collaboration to our institution. And also I'd like to say thank you to Ibu Amalia Rahmawati. Where is Ibu Amalia Rahmawati? She is the lady of this conference, right? And then and also I'd like to say thank you for all speakers from the first until fourth speaker for this webinar, and then all crew who always help and support this webinar series that I can mention one by one. So from the IT, Mr. Nuron, you may shoot Mr. Nuron for wonderful helping and working hard to success international webinar series, right? And also Mr. Sandy, who is also giving us, shoot Mr. Sandy. Right, he is also the mentor of this wonderful international webinar series, and also Mr. Amar. He is an international Masters of Ceremony along this webinar series. And also all crew to working today, please moving around and then say hello. And I would like to say thank you one more time to Taiwan International Healthcare Training Center to support really our webinar series. Hopefully we can come back for the next time for the international webinar series. At the end, I will close webinar series by saying Alhamdulillah to finish all webinar series for this year. One more time, I'd like to say this webinar series is held on in the agenda of 21st of anniversary of Muhammadiyah, University of Muhammadiyah Kudus. Last but not least, I would like to say thank you for your collaboration and attention. My name is Ahmad Nur Safik as the moderator for this webinar. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Okay. Ladies and gentlemen, those are scheduled of Fourth International Webinar Series on Midwifery. It agenda of 21st Anniversary University Muhammadiyah of Kudus. That's all from me as Master of Ceremony. Let's close with saying Hamdalah. Alhamdulillah, Hirabbil Alamin. Billahi fi sabilil haq fasdabiqul khairat. Assalamualaikum warahmatullahi wabarakatuh.